Hello, my name is Kaitlyn Springer, and I am a student at Tennessee Tech University. Today I will be sharing with you about nutrition for adults with type 2 diabetes as my project for Nutrition Through the Life Cycle class. Today I will be discussing the anatomy and physiology basics of diabetes, healthcare team that they may have, dietary considerations, the benefits of exercise, and some example plates. So first, what is happening inside the body of someone with type 2 diabetes? Navigating this condition can be really complex and overwhelming, especially at first for someone with a new diagnosis. So hopefully this basic A&P can help you feel more comfortable with this disease. So first, we have our pancreas. This is the main organ of concern with diabetes. It's a gland organ located within the abdomen, connected to our small intestine. It's pictured to the right up here in purple. This organ belongs to two body systems, both the endocrine, which controls our hormones, and digestive, which is our main concern in nutrition. Among the hormones that the pancreas produces, the most notable for this condition is insulin, which regulates the absorption and use of glucose from the bloodstream after we eat food and break down that into sugars into the cells. And that leads into the next part, insulin sensitivity. In healthy people, their cells are sensitive to insulin, meaning that their receptors are responsive to the presence of insulin, and that allows glucose to enter the cell. So insulin acts like a key to let it in. And then once inside the cell, the glucose can be used as energy. And that's pictured in the diagram on the right. On the top is the normal response. But with type 2 diabetes, which is pictured on the bottom of the diagram, the cells begin to lose their sensitivity to insulin and begin resisting the uptake of glucose. So insulin is still present in type 2 diabetes, and the pancreas continues to produce it, but the body no longer is able to recognize the glucose, so it's just left to circulate in the bloodstream. And the result of this is hyperglycemia, which just means high blood sugar. But this, especially if it occurs chronically over a long period, is related to a number of other health problems. And then third, we have physiological effects of type 2 diabetes. This condition has a progressive nature, meaning that it can worsen over time, but thankfully there's also potential for it to reverse. It has varying severity levels and is related to a lot of secondary conditions, especially as it worsens. So some short-term complications related to it are frequent urination, increased thirst and hunger, fatigue, weight loss, blurred vision, increased susceptibility to infections, and delayed wound healing. And then chronic comorbidities, so some of those conditions that can happen over a longer term are heart disease, hypertension, which just means high blood pressure, blindness, kidney failure, strokes, and limb loss. Often, type 2 diabetes is connected to vascular problems. And this just means anything related to our blood vessels. So it can damage our eyes, leading to a condition called retinopathy, our kidneys, and lead to nephropathy, our nerves, and lead to neuropathy, which is often experienced as like pain, tingling in the feet. And then atherosclerosis, which is like a clogging of arteries in our major vessels or in the heart. Next, we have our healthcare team. So everyone at some point in their life sometimes needs health guidance, and there are very specific professionals that make up the team alongside the patient and their family in caring for diabetes. So general practitioners that almost all individuals with diabetes will see are a PCP, primary care provider, so a physician, the person you see for checkups each year, an RN, registered nurse, an endocrinologist, which is our hormone doctors, an RD or RDN, a registered dietitian nutritionist who will help with food and diet plans, a fitness professional to help with weight management and other concerns, a PharmD, which would be a pharmacist to help with medications, and a DMD or DDS would be a dentist to help with teeth. Some advanced specialists that people may need if they have severe diabetes or just special concerns would be a CDCES, which is a Certified Diabetes Care and Education Specialist, an ophthalmologist for eye problems, a DPM is a podiatrist, which is a foot doctor, mental health professionals, such as psychiatrists, psychologists, clinical social workers. And then if diabetes progresses, it can lead to some of those other chronic conditions that I mentioned before, and especially with amputations, like limb losses, they may need therapy. So they may see therapists. A PT would be a physical therapist, and an OT is an occupational therapist. I personally am pursuing a career as an occupational therapist, which was part of my interest in this group. Next, we have dietary considerations. So what does it look like to eat healthfully when you have type 2 diabetes? Thankfully, lifestyle changes, including diet, can have a significant impact on health and symptoms with type 2 diabetes. And on the right, I'm going to talk about 3 different fields of thoughts or approaches to eating with diabetes. First, carbohydrate counting. With this method, at each meal, a person would look at the portions and types of foods they're eating and guide that by the number of grams of carbohydrates in that food. So with all of our foods, we have 3 macronutrients: carbohydrates, proteins, and fats. And usually each food is a mixture of those, but there are some that have that are mainly carbs. And that's of principal concern to people with diabetes who are worried about blood sugar variations. Reference tables are used with this method that have lists of foods with their typical serving sizes, and those correspond to be about 15 grams of carbohydrates. Typically, men are allowed 60 grams per meal and females 45 grams, so that would allot to around 3 or 4 servings of carbohydrate foods. Another approach in consideration is glycemic index, load, and response. So GI in this context refers to glycemic index, which is defined as a relative ranking of carbohydrates in foods according to how they affect blood glucose levels. And this reflects the quality of the carbohydrates in a given food. On the left, up top, is a graph depicting blood glucose response to a high glycemic index food versus a low glycemic index food. So as you can see in red, there's a big spike and then a deep low. But with low glycemic index, it's more of a steady incline and decline. And that is what we want with type 2 diabetes. We want to aim for a more stable blood glucose response. Another more complex measurement is glycemic load, and that combines both quantity and quality of carbohydrates using a formula. And the goal for a day would be to keep the total glycemic load less than 100 for a person with type 2 diabetes. And then glycemic response is the magnitude, so the size, of the rise and fall of blood glucose and the duration of time over which it occurs. So kind of what we see in that top graph is an example of a glycemic response. And then third, I wanted to talk a bit about plant-based research. So I want to preface with the fact that there are a lot of very specific diets that have been studied for type 2 diabetes, such as the ketogenic diet, Mediterranean diet, and veganism. So this is just one of many, but one that's showing up with some more effectiveness in recent literature. So new studies have found that excess fat deposits in the muscle or liver tissue can hinder insulin sensitivity. Although vegan diets are generally very high in carbohydrates because they're entirely plant-based, so this would kind of go against what we talked about with carbohydrate counting, or just be a different field of thought. These diets have shown to aid in weight loss and improving diabetes. So that weight loss would be through losing some of that excess fat and therefore having better insulin sensitivity, so our cells recognize that insulin as a key and lets the glucose in again. So according to this model, there were 3 healthy eating guidelines for conquering diabetes. And those were, first, to avoid animal products, which is the principle of veganism, keeping oils to a minimum, which would keep fat levels lower, and then favoring low glycemic index foods, not restricting carbohydrates, but choosing low GI ones more often than high GI ones. And then next we have the benefits of exercise. I myself am an exercise science student, so I have backgrounds and passions where I wanted to mention some of the importance of this, because research has shown a lot of benefits of exercise for all people, but especially people wanting to manage their type 2 diabetes. So there are lots of ways we can exercise, and the goal really is to choose something enjoyable, because the more enjoyable it is, the more sustainable it'll be. So some ideas would be hiking, dancing, swimming, weightlifting. There are a lot of options. But here's why. First is that it helps reduce risks. So sedentarism is a term you may hear, and that just means physical inactivity. And it's considered a risk factor for type 2 diabetes and a lot of other diseases, especially cardiovascular ones. But exercise, especially high physical activity levels, reduces the risk of developing or worsening type 2 diabetes. And it does this by reducing body fat levels, managing weight, and improving glucose control. And then specifically some recommendations that are health promoting for individuals with type 2 diabetes. The ACSM says for this population to get more than 150 minutes a week, which would break down to about 30 minutes a day for 5 days out of the week of moderate to vigorous physical activity. And they recommend including strength training, aerobic training, which would be cardio, flexibility, so that could be through stretching, yoga, other methods. And they also recommend to do this very often, daily if possible, and not skipping more than 2 days in a row. One thing that's of special concern for individuals with diabetes is to caution and know the signs of post-exercise hypoglycemia, which would be a low dip in blood sugar. And signs of this could be feeling faint and clammy, other things, but people with type 2 diabetes need to watch out for that. But overall, exercise is very healthful for all individuals. Next, we have example plates. So how do we put these principles into practice? I am using the diabetes plate method created by the American Diabetes Association for my example here. So on the top right, we have a sample layout of how to build a plate for an individual with diabetes. So on the green section, we have a whole half of the plate filled with non-starchy vegetables, fill a quarter of it with protein foods, and the other quarter of it with carbohydrate foods. and then choose a 0-calorie drink or water. So for vegetable ideas, someone could choose a Greek salad made up of spinach, cucumber, tomato, and garlic, and grilled broccoli and bell peppers. For their protein, they could choose grilled salmon or tofu if they were following the vegan approach. For a carbohydrate idea, they could have quinoa, which is a grain, or brown rice, with diced roasted sweet potatoes, and for a drink, unsweetened hot tea. Last, I have my references. All of these are in the American Medical Association citation style. I do want to note that this presentation was built using the online software called Prezi, and Loom was my method for screen recording. So here are my references for the information with their corresponding numbers mentioned throughout the PowerPoint. And then here are my citations for my images used. I do want to note that all images that did not have a number corresponding were ones embedded within Prezi's program already. Thank you very much for watching. I hope that you learned about how to use nutrition to manage type 2 diabetes in adulthood. Thank you.